Hey everybody, my name is Dr. Alan Katz. I practice hyperbaric regenerative and metabolic medicine. I'm the National Medical Director of Hyperbaric Medical Solutions. I'm board certified in hyperbaric medicine. And for Metabolic Health Day, I just wanted to spend 10 minutes with you giving you just kind of a brief understanding or overview of what hyperbaric medicine really is and how it impacts or can impact somebody's health. I like to think of it as using hyperbaric oxygen to try and unlock your body's full potential. In addition to working for Hyperbaric Medical Solutions, I'm proud to say that after 35 years or so of working in both hospital settings, private office settings, and again, as a hyperbaric physician, I completed the metabolic approach to cancer training with Dr. Nasha Winters. And again, major applause there. Great program. She does a great job, and I'm excited to use so much of what I learned from Nasha to help others as time goes on. You know, good metabolic health really just means more energy, a better mood, and a happier, longer, healthy life. Metabolic health is about optimizing your body's ability to create energy, maintaining stable blood sugars, reducing inflammation. Simple stuff. One of the ways that we do that is by using oxygen. In my practice, most of what we're using is hyperbaric oxygen chambers. What's actually going on with hyperbaric oxygen? And when you hear that word, what does it mean? Two things are actually happening in hyperbaric oxygen. You have a combination of oxygen, so I'm looking at somebody's oximetry, so oxygen is involved, and pressure is involved. It's not one, it's not two. That oxygen chamber, or I would prefer to call it a cocoon, the oxygen cocoon changes oxygen and pressure. And what's important is to understand that the amount of oxygen that's being provided is important. When we're at sea level, like most of us are living, and we're breathing room air is 21% oxygen. It's being delivered at 1 atmosphere of pressure, the Earth's pressure on us. So we breathe, the oxygen goes into our lungs into blood. From the blood, it attaches to hemoglobin. Our hemoglobin becomes almost completely occupied by oxygen already. Remember, they put the oximeter on your finger. Most people, the pulse ox reads 97, 98, 99%. It then travels, the oxygen travels to wherever that blood can go. If somebody gives you a little extra oxygen, maybe with one of those devices I showed you in the beginning, in the nose, the mask, it might go to 100, but it maxes out. But in a hyperbaric oxygen chamber, you're now getting not 21% oxygen, but you should be getting 100% oxygen. So you're already getting 5 times the amount of oxygen that you would on room air. But what's more important than that is then the oxygen is being delivered under pressure. So you're in an environment that is now pressurized. That pressure allows oxygen, which is actually a gas bubble, to become squished so that much more of it directly gets into your tissue. It's actually very, very interesting. Believe it or not, if I put you inside an oxygen chamber, a hyperbaric chamber, and compress you to 2.4 atmospheres, let's say 50 feet or so of seawater, 55 feet of seawater, something like that, and administer 100% oxygen, so much oxygen gets directly into your tissue that it bypasses your need for even having blood. So if you're in a chamber at that point, I could completely exsanguinate your blood and you'd be fine. That's important because that tells us that we can now get oxygen to places where blood could never even normally reach. And if blood normally can't reach somewhere, it means oxygen can't get there. In a hyperbaric environment, that's not exactly true. And additionally, not only is the amount of oxygen that's delivered important, but how it's delivered is important. There's something called paradoxical hypoxia. Interesting phenomenon, because a lot of the benefit that we're getting from hyperbarics comes from the times that the oxygen is actually dropping. So what we'll often do is we bring somebody's oxygen level up to a very, very high level and then start to drop it. During that drop, that's when a good chunk of the magic happens. So, I just leave you at this point with the thought that there are different types of chambers. So when people say hyperbaric oxygen, just start to understand There's hard chambers, soft chambers, mild chambers, oxygen-enriched chambers, monoplace chambers, there's different chambers, and different chambers do different things. What about the concept of oxidative stress? You know, we all hear about that all the time, right? It's life in general is about balanced oxidative stress. It's good and it's bad. We need oxidative stress to keep the machinery working. But too much oxidative stress, things go awry. Oxidative stress is simply a condition where the body has too many unstable molecules or free radicals and not enough antioxidants. It occurs when free radicals steal electrons from stable molecules. So, you know, kind of think about it as oxygen-free radical. An oxygen-free radical really has an unpaired electron. So this oxygen-free radical with the unpaired electron is just always running around the body looking for some other electron to pair up with so it can become stable. It's an easy way to remember how it works and how it functions. But where do some of these oxidative stresses come from other than from giving extra oxygen? You're going to get oxidative stress from UV light exposure. You'll get it from radiation exposure. You can get it from smoking. You can get it from pollution. Inflammation itself can give you an oxidative stress. And why is all this bad? All of this bad oxidative stress. So if you have oxidative stress going on and the stealing of electrons, what happens? Well, these free radicals or these electron stealers, they attack cholesterol. They attack your proteins. They attack your DNA. You end up with badness, like atherosclerosis. You end up cancer. All sorts of things go on. Has anyone out there ever heard the word inflammation? Big word now. It's the word to describe aging. And why is it important? Because it's inflammation and it's aging. In other words, the disease of aging is inflammation. What do we mean by that? What do we mean by that is what can we do about it? What if I were to tell you that using oxygen under pressure at the correct dosing decreases inflammation? Specifically, some of the interleukins or cytokines, interleukin 1, 6, 17, tumor necrosis factor, all of these things that you hear about that cause inflammation decrease when using hyperbaric oxygen therapy. A hyperbaric oxygen treatment can be as effective as intravenous steroids, like Decadron or oral prednisolone or intravenous Solumedrol. That's unbelievable. What if I were to tell you that using hyperbaric oxygen, you can go ahead and increase the number of your own circulating stem cells? We all know that we need stem cells to help us with our body. I use this all the time. When I have somebody with, for example, a tear in their rotator cuff or a part of the shoulder or a labral tear, a torn labrum, maybe. Do things like injecting platelet-rich plasma, which is a clustering or a concentrated platelet solution of the patient's own platelets to the area of injury. Platelets work by attracting stem cells. To get more stem cells available, I'll often put the patient in a hyperbaric chamber after the procedure so more stem cells are able to be available to go ahead and fix the tissue. What if I were to tell you that hyperbaric oxygen has a role in antimicrobial effect? What if I were to tell you that when using hyperbaric oxygen, you can, different antibiotics work better. For example, aminoglycosides, quinolones, like Levaquin, Avalox, cephalosporins, Keflex, Ceclor. These medications work better when used with hyperbaric oxygen. What if I were to tell you that somebody's microflora or the gut bacteria start to change markedly in the setting of hyperbaric oxygen? It's a very powerful tool. What if somebody has a wound and the wound is not healing because it's very avascular? We see a 20% acceleration in capillary formation when using hyperbaric oxygen. That's why it's used so frequently to take care of refractory diabetic foot wounds, for example. Would you believe that gene regulation occurs when using hyperbaric oxygen? So talk about some type of epigenetic effect. Over 8,000 genes are either upregulated or downregulated, and it persists for more than 24 hours after a single exposure to hyperbaric oxygen. How powerful is that? Right? Mitochondria, the powerhouses of our cell, production is increased. Mitochondrial efficiency is increased. Metabolic regulation. Glucose metabolism is improved. Insulin sensitivity is improved. We'll oftentimes see a reduction in hemoglobin A1C. This is so profound that when we're treating patients in a hyperbaric chamber and they're insulin-dependent diabetics, we have to really carefully monitor their glucose. We do finger sticks right before, right after treatments, and we won't even let patients be treated if their starting number is too low because we are expecting many times a drop in their blood glucose of 30, 40, 50, 60 points, or 60 milligrams per deciliter. That's huge. It's something to be considered. Lipid profiles see change. Number of adipocytes start to change. So there's an effect in obesity. There's effects in body weight. Cognitively, there are changes. We use hyperbarics to assist when treating neurodegenerative disease. We use it to increase cerebral blood flow. We use it for neuroprotection. We use this many times for the start of dementia, for post-stroke patients, just even for overall aging cognitive decline. How many people here have heard of SASPs? So SASPs think of these as being these secretions from cells that are starting to happen more and more in the senescent cell. SASP secretions are decreased using hyperbaric oxygen. The anti-aging machine, right? There is actually data to show that telomeres, which are the end caps on DNA, are lengthened when using hyperbaric oxygen. I mean, if that's not anti-aging, I don't know what is. There are improvements in skin, both from enhanced collagen density, again, better skin, better collagen, better blood flow. So many body systems are affected when using hyperbaric oxygen. Sarcopenia, which is kind of like an age-related muscle, wasting, is prevented. There's a change in muscle fiber activity in patients where you start to see kind of a shift from that type 1 or that slow twitch muscle, with lots of mitochondria, to more of a type 2 muscle, in the aging population. That shift starts to change. Bone loss is changed. You see inhibition of osteoclasts and increased osteoblastic activity. I published a paper several years ago that showed if you take a postmenopausal osteoporotic woman who fails every treatment that exists in dealing with the metabolic enhancement or the metabolic treatment for this disease process, 1 month of hyperbaric oxygen completely reversed DEXA scan scores and other readings. In regards to cardiopulmonary function, we see increases in things like ejection fraction, which is the ability of the heart to pump. Let's just close with a few little pearls in the world of oncology. Right? Metabolic Health Day, and tumors that are hypoxic are correlated with poor clinical prognosis. How can we stop hypoxia in tumors? Cancer cells are always living on the edge of oxidative stress. Think about what we spoke about before. If they're living on the edge of oxidative stress, we just have to push them over a little bit, whether that's by adding a little extra oxidative stress by using hyperbaric oxygen or high-dose vitamin C or maybe IV artesunate or whatever we're going to use. It's all working off of this same process. Radiation therapy in standard of care in cancer, it's an oxidative stress. We can use hyperbarics to enhance that treatment. We can use hyperbarics to prevent some of the problems that might occur after radiation treatment. We can use hyperbarics to try to decrease the dose of radiation that might be needed. We can use hyperbarics to enhance chemotherapeutic effects. Let's say you're using an oxidative chemotherapeutic, one of the platinums. It's working by creating oxidative stress. We can go ahead and pre-treat or post-treat with hyperbaric oxygen. If we have somebody that's having surgery, we can have them heal quicker, right? We talked about angiogenesis, blood vessel formation, stem cell mobilization. So there's an awful lot that can be done. I want to thank you for allowing me the opportunity to spend a few minutes with you. I am I'm easily reachable if anybody wants to reach out. My LinkedIn is Alan Katz MD. My website is www.alankatzmd.com. My company is Hyperbaric Medical Solutions. Again, we are in Manhattan, we're on Long Island, we're in Boston, we're in Fort Lauderdale, we're in Miami. I hope this was helpful for you, and I hope that you really start to think differently about hyperbaric oxygen, and that you start to think about hyperbaric oxygen and understand that there's hyperbaric oxygen and there's hyperbaric oxygen. And it's best for you to really know what you're really looking to accomplish, and that you do it all the right way. Happy Metabolic Health Day, everybody out there.